I had a lot of discomfort. I was in pain from loss of teeth and abscess, tooth decay. I had already looked and was in the process of seeking a surgeon that would do implants.
Alan was a great guy, very intuitive, smart, surprisingly knew a lot about dentistry, knows his mouth well, and he came to me just broken down. He hadn't gone for a number of years. He had a few missing teeth, he had broken teeth, and his was a combination of putting implants in and then knowing that delicate decision, how much do we remove as doctors and go artificial, and how much do we save?
I wanted someone who'd take a personal interest in me and their work. I wanted to be taken under their wing. I wanted to be their special project. I was a walk-in. And his staff, they just treated me like I was important. When they're taking interest, they say, how can we help you? How can we be of help to you? Have we helped you before? Have you been a patient before? Just when they look at you and they don't look away and they're not looking at their papers, their books, or their computer, they're looking at you and they're addressing you, and they are concerned about how they can meet your needs, answering any of your questions as well as they can. That goes a long way. Goes a long way to see how they were interested, so it sparked my interest.
So his was a really unique case. He's about half his natural teeth and about half implants. He had a little bit of everything. He had some bone grafting done. He had some bone grafting to his sinuses done to get more bone for back teeth. He had a lot of restorative work done. And it's been quite a while. It's well over 10 years since his was done.
Dr. Shoemaker, he addresses the patient's needs. Not just clinical and professional. He always treated me as with interest, and he's a very likable person. His office and his staff are very cooperative.
His case worked out great, super happy with it, and he's a fun guy to work on.